For frontline healthcare workers battling COVID, the hospital can feel like a war room. Turns out it's having the same effect on healthcare workers as soldiers. Dan Grossman shows us the situation that's playing out at hospitals across the country.
Similar to the enemy that cannot be seen, the effects of COVID-19 on those fighting it lie under the surface.
The mental health symptoms tend to peak about 12 months after the actual event.
Dr. Chris Thurstone is the director of behavioral health at Denver's largest hospital. He says for frontline workers, their mental health is facing an unprecedented challenge.
They describe it as a different type of burnout than they've felt before.
A few months before the pandemic hit, the hospital implemented a program developed at Johns Hopkins called RISE, Resilience in Stressful Events. In the weeks before COVID, its drop-in center here at Denver Health saw 30 employees a day. Now it's seeing more than 300 employees a day.
We're certainly seeing increased rates of people who are struggling and having a difficult time.
Tom Dunn is a clinical psychologist and says frontline workers struggling to manage the pressure is not just something hospitals are seeing in our country, but globally. Researchers in Wuhan found 30 to 50% of healthcare providers were in a burnout stage before COVID. Now that number is up to 75%.
Depression, anxiety, insomnia, and substance use. And so those are the four things that we watch out for. As things settle down and people actually get a chance to breathe and think and be themselves again, they might notice that they're not completely themselves.
At Denver Health, calls into the help center have increased tenfold as well, proving that once COVID becomes manageable, another epidemic may soon emerge.
We can't just get through COVID and then pretend nothing happened. This is placing a stress and strain on every human being. And healthcare workers are human beings and no exception.
I'm Dan Grossman reporting.